So the real-world experience has stemmed from its approval on the Cancer Drugs Fund in the UK, which started in 2017 and lasted until June of this year. During that period, it was assessed in the real-world setting, both in national cancer databases, but also in our registry database, which was a proportion of patients that were analysed. And it's clearly it was a very well-received second-line and beyond option, because up to that point we could only use chemoimmunotherapy. We had, a mix of experiences. There are many people who are still on it. Others had to come off because they had either progression or developed some adverse events. But on balance, the experience was very positive, and patients were extremely grateful to have that option. Unfortunately, it is not approved for use any longer in the UK, but those patients who are on it will continue to do so until they no longer need it or move to another therapy.